Hello everybody, this is Mark Laurie, the superintendent in Niagara Falls. And I know I do these YouTube videos every day and I don't wear a mask. Why am I wearing one today? And I'm going to take it down in a moment and you'll see why. But I'm with Dr. Civaroli, our doctor for the school district, and we are fairly close and we want to show that we do wear masks when we're together. I hope you can hear me clearly. I'll slow down and enunciate even more. But we've made it a practice in this district to have face coverings and face masks and be 6 feet apart. So doctor and I are pretty close to that, maybe a little short of it, but we're going to be very careful, and we're going to do some special things today. The reason that we're here today is to talk about testing. Now, testing in the Niagara Falls School District will result in a screening when and if we become in a zone. As you watch the governor's addresses, there are 3 zones: yellow, orange, and red. Currently, on December 2nd, Niagara Falls is not in one of those zones. I pray and hope that everyone continues to work hard so that we stay out of that. But if the event that we were, it would be the district's position, and with the support of our nursing staff, led by Dr. Civaroli, that we would do everything we could to screen and test out of that condition so that we can stay open in the hybrid learning model. Why? It's my personal position as a superintendent that I believe that the best place for kids is to be in school. Now, that doesn't preclude the fact that we've got to use the most up-to-date and proper health and safety measures. I believe with the skill of our nursing staff and the precautions and organizations that we can put in place, we can do this. So today's exercise is to show you what a screening in an orange, red, or yellow zone would look like. And I've got an even more special guest than Dr. Civaroli. No, it's not Dr. Fauci. I know that you were hoping for that, but it's Dr. Laura Lasher. It's Laura Lasher, one of our school nurses, a great school nurse, and here she is. And I'm going to ask Dr. Civaroli to talk about what she's wearing. It's going to be hard to hear, but how long have you been a school nurse?
23 years.
23 years, and you also work at the hospital.
And I also work in the emergency room. Yeah.
And you work in there, and we are blessed, I'll say that, to have skilled nurses like Laura on our team. She works at the high school. She's been there a number of years, and it's a very busy place and a busy location, but she manages it along with her partner very well, and we appreciate all that Laura does. And today she came dressed. Why? Because we're going to do 2 things. I want parents in the community to see what our school nurses wear and put on when they go into the isolation room of a school. And secondly, she's going to demonstrate a BINAC screening test on me. This will be done in your presence, parent, if your child is selected to get a screening test. So we want you to have a good video of what it is. So Dr. Joe, can you describe what Ms. Lasher has on so the parents can see and understand?
Okay, so the first thing she has on is a shield, and that covers and protects her eyes. And then she also has what's called an N100. That is a respirator, so it protects her from 100% of aerosol droplets. She also has on a gown. It's a protective, her clothing, and her also has some gloves on. She has 2 sets of gloves. One set of gloves is for the person that she's taking care of, and if she is done taking care of that child and they're contaminated, she could take them off, and she has a clean set of gloves to be able to take off the rest of her protective equipment safely.
Right. So I thought that was I didn't know that she's wearing 2 pair of gloves. I'm like, why? Well, she's going to have to deal with a child or handle a child, and that pair of gloves gets taken off and disposed of.
Correct.
Into a proper disposal.
Right, a red garbage bag.
A red garbage disposal bag that we have specially arranged for pickup and disposal of. Then she has another pair on so that she can disrobe, so to speak, her gown, her face covering, and the gloves are not touching any part of her body. As much as we need to keep kids safe, we need to keep our nurses safe. And our nurses protected. We can't function without them. So she has all of this on. Parent, your child may be sent to an isolation room. It's part of our clinics in most schools. And this is what you would be visited by a nurse. that's dressed like Laura. And then once, let's say it was myself, my parent picked me up, that room would then be cleaned,
Correct?
and it would sit for a bit of time,
2 hours.
2 hours, and then the next, if necessary, the next student would have to come in. So that's how the isolation room looks. This is what an isolation room nurse looks like. And it's pretty, and a pretty nice person too. At the hospital, or Dr. Joy, is it similar type of a setup?
Yeah.
So it is similar. This is what they would do at a hospital. I want to give parents reassurance that our practices are very similar to what they do in a hospital. Laura Lasher said that she worked there and is trained there and brings those practices over to the district. The next part of our demonstration today is to demonstrate a BinX test. Dr. Joe, would you just tell everyone what this is used for? Is this going to say absolutely I don't have COVID or I do have COVID? Talk about this BinX test.
The BinX test is a screening test. So this would be on children that do not have any symptoms or adults that don't have any symptoms. And we're just going to screen to see what our population is reacting with.
So if I was feeling ill, the signs that we know what they are, headache, nausea, all of those signs we've read all summer, this would not be the test to administer.
This would not be the test of choice.
This wouldn't be, and that's because of the reliability of it. But there is another test.
Right, and that is the Abbott ID Now. It's a test that we're hopefully going to be getting in soon.
That's the test that we have the 2-year license from. But with the backup in manufacturing, it's the test we're still waiting for. But we do have a screening test here, and I'm so cognizant of the fact that our nurse is probably pretty warm in there.
Yeah, we'll go.
She's okay? That I want to, without any further ado, I'm going to now ask Dr. Joe to probably leave the screen, and I'm going to have Laura take over, and I'll try and dictate what's going on, and I'm going to need to take my mask off. So if we were doing screening, someone dressed like Laura would meet your child or meet the staff member. We would sit in a chair.
Yeah, we're gonna be sitting.
I'm going to be sitting. I can take my mask off now because we're going to be closer than 6 feet, but you're protected from me.
Correct.
So I'll take my mask off now, and I'm here ready to take a BinX screening test, which we need to do in order to keep the school open. And you have the equipment right here in front of you, not my pen, but
I do. So, I don't know if you can hear me, but we would start out first of all by verifying that we have the proper person,
right.
matching their information on their sheet.
So I would have a piece of paper that would say I'm Mark Laurie, date of birth, etc., etc. Laura would do her check to make sure that I am Mark Laurie, and in fact I am, much to the dismay of some people, but I really am. I am, and so she would confirm that and make sure that everything was properly documented that way.
Correct. Then we're gonna take our slide, we're gonna open it. This is the stuff, the magic liquid.
So she's got an open slide, a card, magic liquid, and she's placing drops. 4 or 5?
6.
I wasn't even close. She placed 6 drops into an area on that card, on that BinX card. 6 drops of the COVID.
It's like a reagent.
A COVID reagent was placed in the card. Now I'm sit here and look at her,
Okay, so now.
not nervous.
Not nervous. So my recommendation to you is that you do close your eyes, and I will tell you before I'm gonna put the swab in, I'm gonna do both sides of your nose. It's gonna tickle. It does not go in very far, so it should not be painful at all.
So let me repeat that. Laura gave some suggestions that you'll give to every child or staff member.
Yes.
Her suggestions to me was that I close my eyes, that she's going to put this in my nose, not very far. It may tickle. She have my eyes closed and wait for her direction. Is that about right?
Right, we're gonna swab one side, swirl it, and then I'm gonna give you a second to breathe, and then I'm gonna go to the other side.
She's going to swab one side, swirl it, give me a second to breathe, and then go to the other side. An interesting thing that Laura said to me, and why it's really important that she's not only masked up but has that much PPE on, is when she does the swab, there's a chance that I could cough or sneeze, right? When anybody's nose is touched, it may bring on coughing or sneezing. So I'm glad she's PPD'd. I'm closing my eyes. Many people think this is what I do all day at my job, to close my eyes, but in this case, I'm doing it for real. So.
Okay, ready? And I'm gonna have you tip your chin up just a little bit. Okay, I'm going into one side now, and do not pull back. 1, 2, 3, 4, 5. Okay, take a breather. Are you okay?
Yes.
We're gonna proceed with the second side. Same thing. 1, 2, 3, 4, 5. Okay, open your eyes. Please put your mask back on.
Okay. So if you couldn't hear what Laura was saying, she said she did one side, kind of circled my nostril 5 times. It tickled. It really tickled a little bit. And then she gave me 10 seconds to breathe. Backed away, same Q-tip, so to speak.
Yep.
Did the other side, 5 swabs around, tickled a little bit of watering in my eye. Just a little bit, nothing painful at all. I didn't wince or flinch, I don't believe. She then put the stick inside the reagent and she just pressed a timer. Why did you press a timer?
This has to sit for 15 minutes to give us a result.
So she pressed the timer and she set it for 15 minutes and they'll count down, and once the 15-minute timer beeps, you will then open it up and we'll have the result.
So we don't have to open it,
You don't have
we
to
read
open
it right from the front.
Oh, that's really interesting. So you don't have to open it.
No.
She put the stick in, it's touching the reagent,
We swirl it,
swirled it in there, closed it.
and set the timer.
She set the timer, and now we're waiting for 15 minutes. I will not talk for 15 minutes, so we'll probably shut this down. And I wanted to say thank you to Laura very much. It was very comfortable. I like how you told me to close my eyes. I like how you told me to put my chin up a little bit. I like how you told me all the things that possibly could happen. It could tickle. I'm only going to go so far up your nose. All the things that I expected came true. I feel fine. I hope my results are fine. I think they are. And this is what will happen. It's very quick. If you were to be tested in our school district. Now, let me add something here. What would happen at this point is, if this was a real testing situation, Laura Lasher, our nurse, would excuse me. She'd say, "You now may leave. Thank you for your thank you." And I believe, Dr. Civaroli, our practice is going to be that you will hear from us if there's a positive result. If there is no result, you won't hear from us. If you have a positive result and you're a Niagara Falls High School student, Ms. Lasher or somebody on her nursing team, maybe your associate, would give us a call, or Dr. Civaroli's office would give us a call, and we hope everyone is negative. That is then disposed of in the red bag.
Yeah, and that goes in the red bag.
Goes in the red bag, it's disposed of.
And we record it, and then we dispose of it.
Right. It's recorded and then disposed of. So we record my name on my sheet, negative, date, time, all that things. If it was positive, Dr. Civaroli, what would happen then? We certainly would call you, but then what would happen?
We would definitely make a call and let them know. We'd also ask for your primary care provider's telephone number or fax machine number, so we can also get them a copy. You would be called and asked to contact your primary care provider so you can start your treatment plan.
Good. If you're positive, and we hope and pray you are, but if that were the case, you'd get a call from us. We'd ask for your primary care physician, make the call to that person, get a treatment plan going. Of course, you would be quarantined, and then the district would assist in contact tracing, and we would start a progression of things that happen. And something that Dr. Civaroli would do is report that to the state as well,
Correct.
so that we have a seamless flow of information. I want to thank you both very much for your work, not just today, but on behalf of all of the nurses in the school district. This was never anticipated. You didn't sign up for this. Your willingness to do this is greatly appreciated. This is what our nurses look like. I hope that you show this to your children. I hope you feel safe. I hope you know that I took that a legitimate, real way. And I hope that you remember to stay safe and follow all the protocols about a mask and about staying home if you're not well. Thank you very much, and we'll be back to give you the results. Thanks, Laura.